A nurse is fired for healing a poor girl. Years later, she gets a stunning surprise. A dedicated nurse sacrificed her career to save an uninsured child. When the girl recovered, the nurse was fired without mercy. No one could have imagined what would happen next. A story of resilience and hope that will touch your heart. Welcome back. Leave a like on the video, subscribe to the channel, and enjoy the story. The fluorescent lights of Greenfield Valley Memorial Hospital cast harsh shadows across the emergency room as head nurse Jacqueline Parker moved with practiced efficiency between beds. At 45, she carried herself with the quiet authority of someone who had dedicated her entire professional life, 15 years, to this hospital. The midnight shift was typically predictable, the occasional car accident, elderly patients with chest pains, and the weekend revelry gone wrong. But tonight, everything would change. The automatic doors hissed open, admitting a frail elderly woman cradling what appeared to be a small bundle of blankets. Only when the woman stumbled forward did Jacqueline realize the bundle contained a child, a young girl, perhaps 7 or 8, her face flushed with fever, clutching a worn teddy bear. "Please," the woman whispered in heavily accented English, "my granddaughter, very sick. Please help." Jacqueline rushed forward immediately, taking the girl from the grandmother's trembling arms. The child burned with fever, her breathing labored and shallow. Years of experience told Jacqueline this wasn't a routine case of flu or childhood illness. The girl's coloring suggested advanced infection, possibly pneumonia with complications. "Get me a gurney," she commanded the nearest aide. "And page Dr. Morris now." As Jacqueline began assessment, she caught sight of Samuel Whitmore, the hospital administrator, watching from across the room. His presence during a midnight shift was unusual, and the tight line of his mouth suggested he wasn't there on a friendly visit. But Jacqueline had no time to worry about hospital politics. The girl's oxygen saturation was dangerously low, and her pulse raced as her small body fought the infection. "Name?" Jacqueline asked the grandmother as she inserted an IV line. "Omi," the woman replied. "Her name Omi. I am Mrs. Dung." "Insurance information?" This was the question Jacqueline hated most, but hospital protocol required it. Mrs. Dung's eyes filled with tears as she shook her head. "No papers, no insurance. I save money, but not enough." From the corner of her eye, Jacqueline saw Whitmore straighten, his attention now fully on their exchange. The hospital's recent policy changes had been explicit. Patients without insurance or ability to pay were to be stabilized only to the minimum required by law, then transferred to County General, the overcrowded public hospital 45 minutes away. Dr. Morris arrived, scanning the girl's vitals with a frown. "Looks like pneumonia progressing to sepsis. We need cultures, chest X-ray, and broad-spectrum antibiotics immediately." "The patient has no insurance," Whitmore interrupted, stepping forward. "Standard protocol applies." His voice carried the dispassionate tone of someone discussing freight shipments rather than a child's life. Dr. Morris hesitated, his eyes meeting Jacqueline's over the gurney. In that moment, Jacqueline made her decision, one she knew might cost her, but one she couldn't avoid making. "We don't have time," she said firmly. "This child won't survive a transfer to county, not in this condition." Without waiting for approval, Jacqueline began administering the antibiotics while directing the team to prepare for further treatment. Dr. Morris, after a moment's hesitation, nodded and continued his examination, effectively backing her decision. Whitmore's face darkened. "Nurse Parker, a word." It wasn't a request. "After we stabilize the patient," she replied, not looking up from the IV she was adjusting. The night progressed in a blur of activity. Jacqueline stayed well past her shift, monitoring Omi's condition as the antibiotics slowly began to take effect. By morning, the girl's fever had dropped slightly, and her breathing had become less labored. Only then did Jacqueline allow herself to sink into a chair beside the bed, watching the gentle rise and fall of Omi's chest. Mrs. Dung, who had refused to leave her granddaughter's side, reached across the bed and grasped Jacqueline's hand. "Thank you," she whispered, her eyes filled with tears. "You save her life." Jacqueline smiled, squeezing the older woman's hand. She's not out of the woods yet, but she's fighting hard. It was only when she finally made her way to the staff locker room, her body aching with exhaustion, that Jacqueline found the envelope taped to her locker. Inside was a formal termination notice, effective immediately, citing willful disregard for hospital policy and insubordination. 15 years of service ended with a single sheet of paper. If you're enjoying the story, type 5 in the comments and subscribe for more videos like this. If not, type 0. It helps me create even better content for you. Continuing. The following weeks passed in a blur of disbelief and anxiety. Jacqueline's modest apartment, once a peaceful retreat after long hospital shifts, now felt like a prison of uncertainty. She'd always defined herself through her work, her ability to heal and comfort. Without it, she felt adrift, questioning not just her future, but her entire identity. The severance package from the hospital would cover expenses for a few months, but after that, the reality of her situation would become dire. Her nursing credentials remained impeccable, but whispers traveled quickly in the medical community. When she began applying for positions at other hospitals, the interviews would start promisingly, before suddenly ending with vague excuses and promises to keep her resume on file. By the third week, Jacqueline understood the pattern. Whitmore was making calls, ensuring that her insubordination followed her. To the hospital administration, she had become a liability, a nurse who prioritized patients over policies, compassion over cost analysis. In the corporate healthcare world, this made her dangerous. On a rainy Tuesday afternoon after another failed interview, Jacqueline found herself wandering through Westside, the immigrant neighborhood that existed in stark contrast to Greenfield, Valley's manicured suburbs. The streets here were vibrant despite the neighborhood's poverty, filled with small international markets, family restaurants, and colorful murals celebrating diverse cultural heritages. She ducked into a small cafe to escape the downpour, ordering tea she didn't particularly want just to justify occupying a table. The cafe was warm and fragrant with spices, the walls covered with photographs of what appeared to be neighborhood residents and celebrations. "You look like you're carrying the weight of the world," observed a voice. Jacqueline looked up to see a middle-aged man with kind eyes and salt-and-pepper hair sliding into the chair across from her. "I'm Sasha. I own this place." Under normal circumstances, Jacqueline would have politely discouraged conversation, but something about his genuine concern broke through her defenses. Before she quite realized what was happening, she found herself sharing her story: the little girl, the hospital policy, the termination that had ended her career. Sasha listened without interruption, occasionally nodding. When she finished, he sat back with a thoughtful expression. "You know," he said finally, "there's a community clinic 3 blocks from here, Westside Health Project. They're always short-staffed, and from what I hear, the director is more concerned with helping people than following bureaucratic nonsense." "A clinic," Jacqueline repeated. The idea hadn't occurred to her. Her career had been built in the structured environment of a major hospital. "Don't look so skeptical," Sasha laughed. "They need good nurses even more than hospitals do. Less pay, longer hours, but no administrators breathing down your neck about insurance forms." The next morning, Jacqueline found herself standing outside a weathered building with a simple sign reading Westside Health Project. The waiting room she entered was crowded despite the early hour, with families speaking a dozen different languages, harried staff moving between them with clipboards, and an atmosphere of controlled chaos. At the reception desk, a young woman with vibrant blue hair looked up from her computer. "Can I help you?" "I'm looking for the director," Jacqueline explained. "I'm a nurse. I heard you might be hiring." The receptionist's exhausted expression brightened immediately. "You're a nurse, really? Not just volunteering, but actually wanting a job here?" She reached for the phone. "Dr. Santos will definitely want to meet you." 10 minutes later, Jacqueline was seated across from Dr. Thomas Santos, the clinic's director. Unlike the sterile artwork-adorned offices of hospital administrators, his workspace was cluttered with medical journals, community flyers, and children's artwork. The man himself was in his early 50s, with warm brown skin and tired eyes. that nonetheless maintained an intensity that Jacqueline recognized, the look of someone driven by purpose rather than ambition. "Jacqueline Parker," he said, reviewing her resume. 15 years at Greenfield Valley Memorial, impressive credentials. Why would you leave such a prestigious position for our humble clinic? The question was delivered casually, but his gaze was sharp. Jacqueline hesitated, considering a diplomatic answer before deciding that honesty was the only approach that made sense. "I was fired," she said simply, "for treating a child without insurance." To her surprise, Dr. Santos smiled. "I remember you now. We trained together at County years ago. You were the resident who stayed 3 hours after shift to sit with that teenage overdose patient when his parents refused to come." Jacqueline blinked, the memory surfacing slowly. "Thomas Santos, emergency medicine. You were doing your rotation when I was finishing nursing school." "That's right. And if Greenfield fired you for helping a patient, then their loss is our gain." He leaned forward. "Let me be clear. We can offer you less than half what you made at the hospital. We run on grants, donations, and stubborn optimism. Most of our patients can't pay, and we never turn anyone away. We're chronically understaffed, perpetually out of supplies, and constantly battling closure from one regulatory agency or another." "Sounds challenging," Jacqueline said carefully. "Impossible most days," he agreed with a wry smile. "But here's the difference. At the end of those impossible days, you'll know every decision you made was for the patients, not for the profit margin. If that matters to you, the job is yours." Jacqueline looked around the cluttered office, thought of the crowded waiting room, and felt something she hadn't experienced since finding that envelope on her locker. Hope. "When can I start?" The transition from Greenfield Valley Memorial to Westside Health Project was like stepping into another world. Gone were the state-of-the-art monitoring systems, the fully stocked supply rooms, and the specialized teams of healthcare professionals. Instead, Jacqueline found herself improvising with limited resources, treating everything from childhood immunizations to chronic diseases with whatever supplies had been donated or purchased through the clinic's meager budget. But something else was different too. Here, patients didn't arrive with insurance cards and expectations of private rooms. They came with gratitude for whatever help they could receive, often bringing homemade food or small handcrafted gifts as their only form of payment. Where the hospital had felt increasingly corporate, the clinic pulsed with humanity. Will Jacqueline find a way to rebuild her career despite the powerful forces working against her? Or will the challenges of the struggling clinic prove too much even for her experienced hands? During her 3rd week, disaster struck Westside. Heavy spring rains caused flash flooding throughout the neighborhood, and the clinic found itself without electricity, just as patients began arriving with flood-related injuries and illnesses. In the dim emergency lighting, Jacqueline assessed the situation with the calm efficiency that had made her an exceptional nurse. "We need to triage by severity, not arrival time," she told the staff, as water seeped under the clinic doors. "Thomas, do we have a generator?" "It died last year," he admitted. "Budget cuts." Jacqueline nodded, already formulating a plan. "I need volunteers to go to the nearby businesses, ask for camping lanterns, flashlights, anything. We'll set up treatment stations by the windows for better light. And someone contact the medical school. Tell them we need students with clinical experience to help with basic cases." To everyone's surprise, the community responded immediately. Local tea. Restaurants sent not only lights, but hot food for staff and patients. Retired nurses and doctors from the neighborhood appeared, offering assistance. Medical students arrived in groups, eager for real-world experience. By nightfall, the clinic had transformed into an efficient emergency center operating entirely by lamplight. When the electricity finally returned 3 days later, Westside Health Project had treated over 200 patients without a single serious complication. Local news coverage of their improvised operation brought unexpected attention, and with it donations of supplies and equipment from larger medical facilities. "You know what Whitmore would have done," Thomas remarked as they sorted through the donations. "Closed the doors and directed patients to County." Jacqueline nodded, remembering the administrator's cold efficiency. Sometimes the rulebook needs to be set aside. Speaking of Whitmore, Thomas said carefully, I heard he's been calling other facilities, warning them about hiring you. Jacqueline paused, a box of gauze bandages in her hands. I suspected as much. Is that causing problems for the clinic? Quite the opposite, Thomas grinned. After that news segment about our flood response, we've gained some influential supporters. The health department just mysteriously resolved 3 pending violations they've been hounding us about for months. For the first time since her termination, Jacqueline felt the weight on her shoulders lighten. Perhaps there was justice in the world after all. As spring blossomed into summer, Jacqueline settled into the rhythm of clinic life. The pay was, indeed, significantly less than she'd earned at the hospital, requiring adjustments to her lifestyle. But the work brought a satisfaction she'd nearly forgotten. Here, she wasn't just following doctors' orders and hospital protocols, she was developing community health initiatives, training volunteer staff, and creating systems that maximize their limited resources. One busy Thursday afternoon, Jacqueline looked up from updating a patient chart to see a familiar face in the waiting room, Mrs. Dung, the grandmother from the night that had changed everything. Beside her sat a healthy-looking young girl, clutching the same worn teddy bear, now engaged in reading a children's book. Jacqueline's heart skipped a beat as she approached them. Mrs. Dung? Omi. The older woman looked up, confusion crossing her face before recognition dawned. Nurse, the kind nurse from hospital. She grasped Jacqueline's hands warmly. You remember us? Of course, Jacqueline smiled, crouching to meet Omi's curious gaze. The child was transformed from the fevered, barely conscious patient she remembered, now bright-eyed and clearly thriving. How is she doing? Very good, very strong now, Mrs. Dung beamed proudly. We come for check-up only. Doctor say she perfect health. As Thomas examined Omi in one of the treatment rooms, Mrs. Dung drew Jacqueline aside. I hear what happened to you, she said quietly. Because of us, you lose job. I try to find you, to thank you, but hospital people, they not tell me anything. It's not your fault, Jacqueline assured her. I made my choice, and I don't regret it. Mrs. Dung studied, her with shrewd eyes that seemed to see beyond Jacqueline's reassurances. You save Omi's life. This not small thing. She glanced toward the examination room where her granddaughter laughed at something Thomas said. We not forget, never forget. After they left, Jacqueline found herself strangely emotional. Seeing Omi healthy, the tangible result of that fateful decision, reaffirmed everything she'd sacrificed, one life saved. Whatever came next, that would always remain true. The summer months brought a new challenge to Westside. The neighborhood's diverse immigrant community celebrated their cultural traditions with festivals, music, and food. But many residents avoided seeking medical care due to language barriers or fears about documentation status. Jacqueline proposed a solution. The clinic would participate in these cultural events, offering basic health screenings while building trust with community members. At the summer festival, Jacqueline found herself immersed in a vibrant celebration that blended traditions from around the world. Colorful stalls offered foods from a dozen countries, musicians played traditional instruments, and dancers in elaborate costumes performed for appreciative crowds. The clinic's booth, staffed by multilingual volunteers, provided blood pressure checks and basic health information in 8 languages. As the day progressed, Jacqueline noticed that while adults remained hesitant to approach their booth, children were drawn to the simple games she'd devised to teach hand-washing and nutrition basics. The children will bring their parents, she told the volunteers. Just be patient. She was right. By sunset, their team had conducted over 100 health screenings and scheduled dozens of follow-up appointments at the clinic. More importantly, they had begun to bridge the gap of mistrust that had kept so many Westside residents from seeking care. As Jacqueline packed up their supplies, she heard someone call her name. Turning, she was surprised to see Mrs. Dung approaching, elegant in traditional silk clothing that contrasted sharply with the simple attire she'd worn to the clinic. Mrs. Dung, how nice to see you again. The older woman smiled, but there was something different in her bearing, a quiet authority that Jacqueline hadn't noticed before. "Please, call me Lynn. I have been wanting to speak with you privately." She guided Jacqueline away from the festival crowd to a small tea shop nearby. Once seated with steaming cups before them, Lynn leaned forward. "There is something you should know. I am not only Omi's grandmother. In China, before coming here, I was doctor, specialist in respiratory medicine." Jacqueline stared in surprise. "But at the hospital you never mentioned—" "I cannot practice here," Lynn explained. "My credentials not recognized, and at my age, starting over with American medical training, impossible. But I know medicine. I know when child has pneumonia, progressing to sepsis. I know Omi would not survive trip to county hospital. That's why you came to Greenfield instead of county in the first place," Jacqueline realized. Lynn nodded. "I choose carefully. I watch emergency room many nights. I see which nurses show compassion, which doctors listen carefully. I see how you treat patients. I knew you would help, even without insurance." The revelation stunned Jacqueline. "You were testing us." "Not testing," Lynn corrected gently. "Trusting. And you prove my trust right." She sipped her tea thoughtfully. "But there is more. The simple grandmother I present to world, this is only part of truth. I come to America 10 years ago after my daughter, Omi's mother, die. I bring some money, start small business. Now I own 4 restaurants, 2 import companies." Jacqueline's teacup froze halfway to her lips. "You're a businesswoman?" "I keep low profile for many reasons," Lynn said with a small smile. "But I have resources, and I wish to help clinic that employs nurse who saved my granddaughter." Before Jacqueline could respond, Lynn reached into an elegant handbag and withdrew a check. When she slid it across the table, Jacqueline gasped at the amount, enough to fund the clinic's operations for months. "I cannot accept this without discussing it with Thomas," she said finally. "Of course," Lynn agreed. "But please understand, this is not charity. This is investment in community health, in people like you who do right thing even when difficult. Have you ever met someone who changed your life unexpectedly, the way Lynn appeared in Jacqueline's? Perhaps someone who recognized your value when others didn't? Share your experience in the comments below." As autumn approached, Jacqueline found herself increasingly immersed in the West Side community. Her apartment lease had expired, and she'd moved to a smaller place just blocks from the clinic, cutting both her rent and commute. The neighborhood embraced her as one of their own, with patients stopping to chat in the local markets or bringing her homemade specialties from their native cuisines. With Lin Deng's donation, which Thomas had gratefully accepted after his initial shock, the clinic underwent modest renovations. They repaired the ancient plumbing, purchased critical equipment, and expanded their pharmacy formulary. The improvements allowed them to serve more patients, but also attracted unwanted attention from regulatory agencies that had previously ignored the small facility. One Monday morning, Jacqueline arrived to find Thomas staring grimly at an official letter. "Health Department," he explained. "Surprise inspection next week. If we don't address 37 critical deficiencies, they'll shut us down." Jacqueline scanned the list with growing indignation. Half of these are cosmetic issues that have nothing to do with patient care, and the equipment upgrades they're demanding would cost thousands we don't have. "Convenient timing, isn't it?" Thomas sighed, "just when we're finally making real progress." The implication hung between them. Was Whitmore reaching beyond Greenfield Valley to continue his vendetta? That evening, Jacqueline stayed late reviewing the clinic's medication inventory. The new pharmacy system she'd implemented had improved efficiency, but something about the numbers didn't add up. Certain medications, primarily antibiotics and pain relievers, were being depleted faster than patient records indicated they should be. As she dug deeper into the discrepancies, she heard a noise from the back storage area. Cautiously investigating, she discovered Thomas carefully packing a box with the very medications that showed inventory irregularities. He froze when he saw her, guilt written plainly across his features. "Jacqueline, I can explain." "You're diverting medications," she stated flatly. "Why? Are you selling them?" Even as she asked, she knew that wasn't the case. Thomas wasn't motivated by money. If he were, he'd have left the struggling clinic years ago for a lucrative private practice. "Not selling," he admitted, shoulders slumping. Distributing. My brother runs an underground clinic for undocumented immigrants too frightened to come here officially, people who would otherwise receive no care at all. Jacqueline remembered the night she'd treated Omi, despite hospital policy. Wasn't this the same principle, helping those the system would otherwise abandon? Yet she also understood the risk. If discovered, the clinic would certainly be shut down, and they could both face criminal charges. The inspection, she said, slowly. If they find evidence of this— I know, Thomas interrupted. I'll stop, find another way. But Jacqueline was already thinking beyond the immediate crisis. No, she said finally. We need a better solution. One that lets us help everyone legally. Over the next 3 days, Jacqueline barely slept as she developed a proposal for an outreach program that would bring healthcare directly to underserved populations without requiring them to visit the clinic. Using her nursing network, she identified volunteer practitioners willing to participate and developed protocols that would satisfy regulatory requirements while protecting vulnerable patients. The day before the inspection, she presented her plan to Thomas. An official mobile health initiative, she explained, fully documented, transparent, but designed to reach people who can't or won't come to us. Thomas studied the proposal with growing excitement. This could work, but the startup costs— already covered, Jacqueline smiled. I spoke with Lynn. She's willing to fund the initial phase as a pilot program. The inspection, when it came, was rigorous but survivable. The clinic addressed the most critical safety issues, explained their plan for correcting others, and unveiled the new outreach initiative as evidence of their commitment to compliant, high-quality care. To their surprise, the lead inspector seemed genuinely impressed with their efforts despite limited resources. You've done remarkable work here, she told them as the inspection concluded. Most facilities with your funding constraints would have closed years ago. As the inspection team departed, Thomas turned to Jacqueline with newfound respect. You know, when I hired you, I thought I was doing you a favor. I'm starting to think it was the other way around. As winter settled over Greenfield Valley, the Regional Medical Association announced its annual innovation competition, a prestigious contest with a substantial grant award for the winning healthcare initiative. Despite Thomas's skepticism about their chances against large hospitals with dedicated research departments, Jacqueline insisted they enter. We're doing things here that nobody else is attempting, she argued, integrating community-based approaches with conventional medicine, creating culturally responsive care models. That's genuine innovation. Working nights and weekends, Jacqueline compiled their application, documenting the clinic's unique approaches and measurable outcomes. When the finalists were announced in January, the entire staff gathered around as Thomas opened the email. We made it, he announced incredulously. We're presenting at the conference next month. The celebration was overshadowed only by the name of their primary competition, Greenfield Valley Memorial Hospital, presenting an initiative on cost-effective community care led by none other than Samuel Whitmore. He's appropriating our methods while systematically trying to shut us down, Thomas fumed. Jacqueline felt cold anger settle in her stomach. Then we'll just have to show the judges who's truly serving this community. The preparation for their presentation consumed every spare moment. Jacqueline gathered testimonials from patients, documented health outcome improvements, and prepared compelling visuals that demonstrated their impact despite limited resources. Lynn provided professional translation services to ensure immigrant patients could share their experiences accurately. The night before the conference, an unexpected snowstorm hit the region. Roads became treacherous, and Jacqueline worried about their team's ability to travel to the convention center 30 miles away. As she checked weather updates, her phone rang with an unfamiliar number. Nurse Parker, this is Margaret Chen, from Greenfield Valley Emergency. Jacqueline's grip tightened on the phone. Yes, we have a situation here. The storm has caused multiple accidents, and we're overwhelmed with trauma cases. Half our nursing staff couldn't make it in because of road conditions. The woman hesitated. I know this is unorthodox, but we need experienced trauma nurses desperately. Whatever happened with administration? Right now we just need help." Jacqueline closed her eyes, weighing the request. This was the same hospital that had discarded her without hesitation, that had actively worked to prevent her from finding new employment. Yet there were patients in need, the very reason she'd become a nurse in the first place. "I'll be there as soon as I can safely drive," she said finally. The emergency room was chaos when she arrived, every bed filled, staff rushing between critical patients, the waiting room overflowing with injuries ranging from minor to severe. Margaret, the charge nurse who had called her, looked near tears with relief when Jacqueline appeared. "Thank God," she breathed. "We've got 3 major traumas coming in and barely enough staff to handle what's already here." Jacqueline set aside her personal history with the hospital and stepped seamlessly into the role she'd performed for 15 years. She assessed patients, started IVs, administered medications, and coordinated with physicians who were too focused on saving lives to care about her employment status. Hours passed in a blur of urgent care. Near dawn, as the crisis finally began to abate, Jacqueline found herself working alongside a young doctor, treating an elderly man with chest pain. After they stabilized the patient, the doctor turned to her with curious eyes. "You're Jacqueline Parker, aren't you? The nurse who was fired for treating that uninsured child last year?" She tensed, expecting criticism. "Yes." To her surprise, he extended his hand. "I'm Dr. Eric Weiss. I was in my residency when that happened. Just wanted to say, a lot of us thought what the administration did was wrong. Your reputation here, well, many considered you the best nurse in the department." Before she could respond, a familiar voice interrupted from the doorway. "Nurse Parker, I thought I recognized you." Samuel Whitmore stood there, his expression unreadable. Unlike the immaculate suits he typically wore, today he appeared rumpled and exhausted from the overnight crisis. "Mr. Whitmore," she acknowledged coolly, "I was called in to help with the emergency situation." "So I see." He glanced around the department, which was finally returning to some semblance of order. "Would you join me in my office briefly? There's something we should discuss." Dr. Weiss looked concerned. "She's been here all night helping us, Whitmore. Whatever administrative issues you have can wait." "This isn't disciplinary," Whitmore assured them, though his tone remained formal. "Please, Nurse Parker. 5 minutes." Curiosity overcoming caution, Jacqueline followed him to the administrative wing. His office was exactly as she remembered, meticulously organized, with charts and graphs displaying the hospital's metrics in terms of costs and outcomes. "I understand you're presenting at the Healthcare Innovation Conference today," he began without preamble. "If the road's clear," she confirmed, wondering how he knew. "I've reviewed your clinic's application materials." He tapped a folder on his desk. "Impressive results with minimal resources." Jacqueline remained silent, waiting for the true purpose of this conversation. "You were right," he said finally, the words seeming to cost him considerable effort. "About the girl, Omi. I've reviewed the case multiple times. The transfer would have been problematic. It was as close to an admission of error as she was likely to get from him. Then why continue trying to prevent me from working elsewhere?" What will happen when Jacqueline finally confronts the man who destroyed her career? And how will she perform at the Healthcare Innovation Conference after working through the night in an emergency? The answers will surprise you. "Hospital liability concerns," he replied, not quite meeting her eyes. "But after seeing what you've accomplished at Westside, perhaps there are alternative approaches worth considering." Jacqueline studied him, trying to understand this unexpected shift. "Is that why you entered the innovation competition with a community care initiative? To show you've seen the light?" "Partly," he admitted. "The board has been pressuring administration to improve community relations. Your clinic's methods, while unorthodox, show promising efficiency metrics." Of course, she thought. Even his acknowledgement of her success was framed in terms of metrics and efficiency rather than patient outcomes or human dignity. "I'll be blunt, Whitmore. I have a presentation to prepare for, and I haven't slept all night because I was helping your hospital manage a crisis. What do you want?" He straightened, back on familiar ground with direct negotiation. "I'm proposing a collaboration. Greenfield Valley's resources combined with your clinic's community approach. We withdraw our competing application and present a united initiative. The offer was tempting. Access to the hospital's vast resources would transform what the clinic could accomplish. Yet something felt wrong. And who would control this? Collaboration, she asked. Who would make decisions about patient care versus cost management? His slight hesitation told her everything. This wasn't about recognizing the value of the clinic's approach. It was about absorbing and controlling it. Thank you for the offer, she said, rising to leave. But we'll present our own work. May the best healthcare model win. Despite exhaustion, Jacqueline made it to the conference center just as their presentation slot approached. Thomas had brought their materials, and the team waited anxiously as she slipped into the room. "You look terrible," he whispered as she joined him on stage. "Are you okay to do this?" "Never better," she assured him, drawing strength from the journey that had brought her to this moment. As they began their presentation, technical difficulties struck. The projector failed, leaving them without their carefully prepared visuals. For a moment, panic fluttered in Jacqueline's chest. Then, drawing on the same adaptability that had served her through every crisis, she stepped forward. "Ladies and gentlemen, perhaps this equipment failure is fitting. At Westside Health Project, we've learned to deliver exceptional care without the technology and resources that many take for granted. So today, instead of showing you slides about our work, I'd like to introduce you to the people who make it possible." She gestured to their team, the receptionist with blue hair who managed their chaotic waiting room with unfailing good humor, the pharmacy technician who created tracking systems that stretched their medication budget, the volunteer translators who ensured no patient went misunderstood. Each briefly described their role in the clinic's integrated care model. As they spoke, Jacqueline noticed movement in the audience. Healthcare workers from both the clinic and, surprisingly, Greenfield Valley Hospital were standing one by one. Nurse Parker created a diabetic management program that reduced our emergency complications by 63%, called out a community health worker. She established protocols that helped us deliver care during the flood when we had no electricity for 3 days, added another. Most surprisingly, Dr. Weiss from the emergency room stood. Last night, during the snowstorm crisis, Nurse Parker returned to the hospital that had terminated her to help save lives. That's the kind of healthcare professional we should all aspire to be. The judging panel watched with evident emotion as more testimonials poured in spontaneously. When the presentation time expired, the lead judge simply said, "I think we've heard what we needed to hear." That afternoon, Westside Health Project was announced as the winner of the Innovation Grant, funds that would secure their operations for years to come. As congratulations flowed around her, Jacqueline caught sight of Whitmore at the back of the room. He offered a small, grudging nod before departing. "We did it," Thomas marveled as they celebrated that evening. "Actually beat Greenfield Valley at their own game." "It wasn't a game," Jacqueline corrected gently. "It was always about the patients." As winter gave way to spring, Jacqueline received a mysterious invitation to attend an event at Westside's newly renovated community center. The card offered no details, only a date and time signed by Lin Dung. When she arrived, Jacqueline was astonished to find the center filled with hundreds of people, patients from the clinic, community members, and healthcare professionals from across the region. At the front of the room stood Lin, elegant in a traditional silk suit, with Omi beside her in a matching dress. As Jacqueline made her way through the crowd, people touched her arms and shoulders, murmuring thanks and congratulations. "What is all this?" she asked when she reached Lin. The older woman smiled. "Patience, my friend, all will be explained." Thomas joined them at the front, looking equally mystified. When the room quieted, Lin stepped to a microphone. "1 year ago," she began, her accented voice clear and strong, "my granddaughter was dying. Hospital policy said she should be sent away because we had no insurance. One nurse stood against this policy and saved Omi's life." Murmurs rippled through the crowd as Lin continued. "Today I am honored to announce the establishment of the Westside Healthcare Foundation. This foundation will support accessible, compassionate healthcare throughout our region. with nurse Jacqueline Parker serving as its director. Gasps and applause filled the room as Lynn handed Jacqueline an elegant folder containing legal documents. "The foundation has been endowed with $15 million, Lynn continued over the noise, "enough to ensure that no one in our community will ever be denied essential care due to lack of financial resources." Jacqueline stared at the documents in disbelief. "Lynn, I don't know what to say." "Say nothing. Your actions have spoken for you," Lynn replied softly. "Sometimes the greatest journeys begin with what seems like an ending." As the celebration continued around them, Jacqueline noticed a familiar figure approaching. Samuel Whitmore, looking distinctly uncomfortable among the West Side residents. "Congratulations," he said stiffly. "The hospital board has asked me to extend an invitation. They would like you to develop a lecture series for our medical students on community-responsive care practices." Jacqueline raised an eyebrow. "Are you sure you want someone who was fired for insubordination influencing your future doctors?" A flicker of something like respect crossed his features. "The hospital has re-evaluated its position. Your methods at Westside have proven effective by every metric, including the ones that matter most." As he walked away, Thomas laughed incredulously. Did Samuel Whitmore just admit that patient outcomes matter more than cost analysis? Miracles never cease, Jacqueline smiled. In the weeks that followed, Jacqueline found herself at the center of a healthcare revolution in Greenfield Valley. The Foundation's resources allowed Westside Health Project to expand its facilities and services while maintaining its community-centered approach. More surprisingly, other medical institutions began adopting their integrated care model, sending staff to learn from the clinic, once dismissed as too small to matter. The following spring, exactly 2 years after her termination, Jacqueline stood before a graduating class of nursing students at the county college. Her lecture on ethical healthcare delivery had become the most requested session in the curriculum. "Healthcare is not merely a service industry or a scientific discipline," she told the attentive students. "It is a sacred trust between provider and patient. When systems forget this fundamental truth, it falls to individuals to remember it." After the lecture, a young woman approached her shyly. "Nurse Parker, I was hoping to speak with you about the Foundation's fellowship program. I want to work in community health, but my student loans..." Jacqueline smiled, recognizing the same passion that had driven her own career. "Let's talk about how we can make that happen." As they walked together toward her office, Jacqueline reflected on the journey that had brought her here. The night she'd lost everything had actually been the beginning of finding something greater, her true purpose, a community that valued her skills, and the opportunity to transform healthcare beyond what she could have accomplished within the hospital's constraints. Through the window, she could see the clinic where it all began, now expanded and renovated, but still maintaining its welcoming character. Across the street, Lynn and Omi were planting flowers in the community garden they had established, living, proof that sometimes doing the right thing, despite the cost, leads exactly where you were always meant to be. Congratulations. Type 9 in the comments so that I know you stayed until the end with me. Thank you for watching, and until tomorrow's story on this same channel,